May is Melanoma Awareness Month. While it accounts for only about 5% of all skin cancer cases, it is dangerous, deadly, and is the leading cause of death from skin disease. Dr. Marta Rendon of Boca Raton Regional Hospital is here to answer your questions. Thank you so much for joining us.
Thank you for having me, Marcy.
So first, what is melanoma?
Well, melanoma is actually the most serious type of skin cancer, and it can happen to anybody. It can arrive from a mole or from a new mole that just pops up somewhere.
And how is it different from, we hear of skin cancer, but what makes melanoma different?
Well, melanoma is the most serious one. There's three types of skin cancer. One of them is a basal cell carcinoma, squamous cell carcinoma, and melanoma. And the only one that really kills people, and 1 American dies of melanoma every hour. So it's the statistics are startling. But that's how it differs. It's a different type of cell that causes this skin cancer.
And are there other ways that a person could get melanoma other than skin exposure? Is it hereditary?
There is a genetic predisposition. So either you have a genetic predisposition or if there's some kind of immune suppression. But sun exposure is probably the most likely cause of skin cancers, of a lot of our skin cancers.
Is there a group that's more at risk for developing it than others?
People that are light complected, light hair, light skin, light eyes are at higher risk. Also, anybody can develop it, but if you've had a family member that has had melanoma, or if you yourself has had a melanoma previously, you are going to be at higher risk. Also, if you have more than 50 moles in your body, you're at higher risk of developing melanoma, or atypical, abnormal looking moles.
So those are the symptoms, the moles. Are there any others?
Any other
symptoms of melanoma?
Well, if you have a mole or if you have a spot that changes color, that bleeds, or a sore that doesn't heal. I mean, any abnormality that you find on your body, you should go and have your dermatologist check it.
And how is it diagnosed?
Clinically, it's by observation. So normally what happens, you see something abnormal, you go to your doctor, your dermatologist, you show them the mole or the sore, and he will take a biopsy, and that's how you confirm the diagnosis. If there's a suspicion, you biopsy it, and that's your final diagnosis.
And how is it treated?
There's a lot of different treatments. Normally, the best way is with surgical excision. If you catch it early before it attacks your lymph nodes, you have a 98% 5-year survival rate. So the key is to get it early. And if there's metastases to lymph nodes, you could go with chemotherapy or radiation therapy.
Okay, thank you so much for being here with us. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.